When I thought about this hearing, I could not help but think about the 1997 film of Good Will Hunting. If you'll recall, in Good Will Hunting, we had Matt Damon and Ben Affleck and Robin Williams, and Matt Damon played as a troubled youth, and his psychiatrist, played by Robin Williams, was trying to help him because he kept getting into trouble. You remember that? And for some reason, there is one sentence in that entire film that I shall never forget. When the psychiatrist, played by Robin Williams, went up to the young youth who had been in and out of trouble and had all kinds of problems, and he said these words. He said, "It's not your fault. It's not your fault." And so today we are examining a critical issue that does not get enough attention here in Congress or throughout the nation: childhood trauma. Childhood trauma is a pervasive public health issue with long-term negative health effects that cost the United States billions of dollars. In 1998, the Centers for Disease Control and Prevention published a landmark study that found that adults who suffered from adverse childhood experiences, also known as ACEs, are at a much greater risk of several leading causes of death, including heart disease, lung disease, cancer, substance use disorder, and suicide. The study examined the effects of adverse child experiences such as abuse, neglect, or separation from a parent. And it also examined the long-term effects that these events have on children throughout the rest of their lives. The science is powerful. Traumatic experiences can injure the developing brains of children, create lifelong impairments to their ability to manage stress and regulate emotions, and significantly increase the likelihood of negative health outcomes. As we will hear today, a growing number of researchers, medical professionals, public health experts, and government officials warn that childhood trauma may be one of the most consequential and costly public health issues facing our nation today. The CDC recently estimated that cases of substantiated child maltreatment in 2015 alone will generate consequences that will cost the United States $428 billion. As staggering as that may sound, the CDC warns that this estimate likely undercounts the true cost to our nation because it examined only some of the types of trauma that children experience. The good news, and the reason we are holding this hearing today, is that childhood trauma is preventable and treatable. The effects of traumatic experiences can be identified. Damage can be healed, and children who have experienced trauma can become thriving and productive adults. To do this, we need a comprehensive federal approach that recognizes the severe impact of childhood trauma and prioritizes prevention and treatment. I applaud the efforts of dedicated professionals at the CDC and other agencies to address childhood trauma. However, efforts at the federal level are still severely underfunded, and they do not provide the comprehensive whole child approach we need to combat this crisis. Childhood trauma is a nationwide public health issue associated with an epidemic of negative health consequences. For example, in 2017, substance use disorder, and suicide took approximately 150,000 lives in this nation and reduced life expectancy for the third year in a row. The federal government should be providing national leadership and resources to combat this public health epidemic. Some states and localities are implementing promising programs to help prevent and treat childhood trauma that can inform federal solutions. State and local health agencies are on the front lines of the childhood trauma crisis. They are confronting many of the negative health consequences that trauma produces. Sadly, I see this every day in my city of Baltimore, where far, far too many of our community's children are suffering severe trauma, including experiencing or witnessing violence or losing parents to violence, incarceration, or substance use. As we will hear today, and state and local agencies are pioneering innovative interventions to address the crisis, and I want to thank all of our partners in this effort. The Government Accountability Office has highlighted several of these promising efforts. However, it has also warned that states are facing limitations in funding, technical capacity, and personnel to address this complex and multifaceted problem. I often tell my staff that when people come into my office who are troubled, that they must remember that many of the problems that they suffer today started when they were a child. And there are two paths of life, I tell them. There's one path that is your destiny. The other path is development. And you've got to have both. And so, as a nation, we have a significant economic incentive, and more importantly, a profound moral imperative to ensure that our children have the opportunity to thrive and succeed. That is why we are having this hearing today. And I want to thank all of our witnesses. Everybody is here. And now I am pleased to yield to our distinguished ranking member, Mr. Jordan, for his opening statement.